Comlex 5-minute review. Please visit comlexflashcards.com for more resources such as daily lectures, podcasts, and question and answers on how to prepare for the Comlex board exam. Today's topic is sleep disorders. Let's talk about primary insomnia. This is mainly a disorder that affects 30% of the general population, resulting in a difficulty of initiating or maintaining sleep and a history of non-restorative sleep. This has to be present at least 3 times a week for 1 month. Okay, and the treatment is first involves initiation of good sleep hygiene measures such as setting up a regular schedule, limiting caffeine, avoidance of daytime naps, warm baths, use of bedroom for sleep, exercising early, relaxation techniques, and avoiding large meals near bedtime. Pharmacotherapy can be used if the good sleep hygiene methods are not successful, and mainly it revolves around initiating pharmacotherapy for short periods of time in order to avoid dependence on some of these medications. And they include Benadryl, that's diphenhydramine, Ambien, that's zolpidem, and Sonata, which is zaleplon, and Deseril, which is trazodone. Okay, so these are the key medications. For primary hypersomnia, this is diagnosed when the patient complains of excessive daytime sleepiness or nighttime sleep that occurs for greater than 1 month. Okay, and it's not attributable to any medical condition. And the first line therapy is starting a patient on stimulant drugs like amphetamines, and antidepressants such as SSRIs may also be useful. Let's talk about narcolepsy. This is a condition that manifests as excessive daytime somnolence and a decreased REM sleep latency. For a daily basis for at least 3 months, patients have sleep attacks that are classic symptoms, and they can't avoid actually falling asleep. The characteristic excessive sleepiness has several characteristics in itself, such as cataplexy, which is sudden loss of muscle tone that leads to collapse, hypnagogic hallucinations that occur when the patient is falling asleep, hypnopompic hallucinations that occur as the patient awakens, and sleep paralysis, which is brief paralysis upon awakening. You want to treat the patient with a regimen of scheduled daily naps plus stimulant drugs such as amphetamines, and SSRIs have been shown to be helpful for cataplexy. Now, sleep apnea, there's 2 types, okay, and it could occur due to a difficulty in breathing, and that can in turn lead to sleep disruption. Let's talk about central sleep apnea. This is a condition in which both the airflow and the respiratory efforts stop, and it's linked to morning headaches, mood changes, repeated awakenings during the night. So the key here is mood changes and morning headaches. With obstructive sleep apnea, you have a patient who is snoring, okay? And it's mainly as a result of respiratory passages, which are not working properly. And the risk factors include male gender, obesity, deviated nasal septum, a large uvular tongue, and retrognathia, which is basically a recession of the mandible. In both forms, though, it's important to understand that with infants and elderly, sudden death has been associated with these conditions, and patients will complain of headaches, depression, increased systolic blood pressure, and another key association is with that of pulmonary hypertension. To treat this, sleep studies are first line. Polysomnography, they document the number of arousals, decrease in O2 saturation, and you can distinguish between OSA, which is primarily respiratory component, and CSA. And with OSA, remember that you're going to find snoring, male gender, and obesity, whereas with CFA, you have morning headaches and mood changes. In terms of the treatment for obstructive sleep apnea, you're going to start the patient first line on CPAP, continuous positive airway pressure, and also recommend weight loss. And in children, if the condition is due to tonsillar or adenoidal hypertrophy, then you want to go for surgery. And for central sleep apnea, mechanical ventilation is key here. So you're going to go with the BPAP with a backup rate of, backup rate which is there for severe cases. Here's our references, and please visit comlexflashcards.com for complete Comlex prep resources, including daily podcasts and more posts every day to understand how you should approach the Comlex. And good luck in your preparations.